Welcome you once more to my channel, to the exposition of the very necessary relationship, the symbiotic relationship that should exist between you and the laboratory. The medical laboratory scientist has a very great role to play in maintaining your well-being. The blood, we know very well, is very necessary for our very existence. But there are certain constituents, there are certain factors in the blood that when they are in low supply, diseases, sickness of all types, we call some of them anemia. The different type of anemia is what I shall be treating you on today. As we journey along, if you are interested in this program to continue, the content to improve, just press the subscription label, press subscribe, press it, and click on the like button, and I'll be able to sustain the momentum that I am using in bringing this program to you. Thank you as we move into my studio. Thank you.
Yeah, welcome back. I'm sure by now we are where we want to be. The outline today is on the anemia. The topic is very interesting because it has to do with the common problem we talk about. Anemia. Anemia is a worldwide problem, and we need to understand it very well. That's why I have chosen it, so that you can have a better understanding of what the problem of anemia is. The starting point is the Medical Diagnostic Laboratory and your health. Anemia is our problem that we shall be highlighting. The outline of today's topic is to start with the introduction. Anemia is ordinarily known to the layman as shortage of blood. Just tell the layman what is anemia. If you want to communicate effectively with him, tell him there is a shortage of blood in the system. The WHO sees it from a different perspective. Worldwide, it's a worldwide phenomenon. It affects almost a very large population of people that present with public health problems, one sickness or the other. So you will see how that WHO came to, and it's seen from the perspective of iron deficiency. So just to see how that iron deficiency in the whole blood is corrected. To the laboratory scientist sees anemia from the perspective of that condition. What is he going to do, or what is she going to do to let them know the present situation, the present condition? So when you come to the lab, whether you are sick or not, what is the present condition of your blood? The present condition of your blood is what the laboratory scientists will define anemia as. That is, how rich or how poor is your blood. The other aspect is that you can be sent to the lab to check, to confirm that yes, you are anemic. Majority of people, you will try to put your finger in their eyes and then check whether there is the lead is pale. So that's where the word pallor is, because when the blood is rich, it is red. The iron content comes out. The hemoglobin is rich in iron, so it comes out red. But how do you confirm that this is not guesswork? The exact volume, it is the laboratory that will now check it. I will come to the laboratory diagnosis. Then the laboratory scientist also helps check what is the present, how effective is that treatment you are undergoing. So it's like a monitoring and evaluating situation. Monitoring that your blood is improving with the treatment that you have been given. Whether it's blood, a whole blood that you are short of, you are given a whole pint of blood, they need to monitor whether your blood has now reached the normal level. Whether you are being treated for malaria, which is a cause of the disease. So we have different types of anemia, and that is, you have the one that you want to call iron deficiency anemia. you have the megaloblastic anemia. You even have sickle cell anemia. You have aplastic anemia, where the bone marrow is not even producing. There's a kind of genetic problems at times that the person cannot really produce enough blood. So all that we are going to check. That's why I listed it in the outline. Other causes we have mentioned: malaria, we have HIV, we have African trypanosomiasis, leishmaniasis, and all the just mentioned, be calling them, and you will be associating them with anemia, because the person suffers one, whether mild or serious situation of anemia. Hemolytic anemia is also there. So the laboratory diagnosis is what I shall be going into, and I want you to really be up and doing with this program. So please subscribe. Subscribe by pressing the label subscribe, and that is, I am telling you, click like if you like this program. The more you are able to do that for me, the better that the program will continue to be rich. The content will be rich. So let's go on into how. But before that, let us even check how the WHO came about the problem of really declaring a public health issue. The magnitude of the public health problem can be seen in this thing I'm exposing this diagram. The high population, almost 40% of people are seriously having one disease that shows they are anemic. The other people who are moderately sick are in the percentage of 20 to 39. So people who are not so seriously sick, you find that but by the time they check their blood volume, that is the blood itself, they present with anemia. Then you have the mild percentage. They are not moderately sick, they are mildly sick, but that is the presentation. The people that has no public health issue just constitute 4.9% of a total population of the whole world, because the WHO has the right to pull it up, taking the whole, whether the rich country, the underdeveloped country, and so on. And this is the correct picture, which warranted that the public health anemia is a public health issue, and it should be addressed at the public health level. So you know, the pregnant women are given the micronutrients and vitamins and iron tablets, post, prenatal, postnatal. These are all ways of addressing the issue. Thank you for listening so far. We shall go on to the laboratory diagnosis, and that will help us to know more. Blood samples have been collected in the container, the appropriate container, and is taken to the lab. The lab will now start immediate work, where you test for the hemoglobin using the spectrophotometer. It tells you the concentration of the hemoglobin to determine the type of anemia. There is also the packed cell volume that checks the fraction of the total blood, that is the packed cell of the red blood cells to the total blood in the capillary tube, and that is what is now measured after spinning in the hematocrit centrifuge. You now read it with this reader. This is where blood films are done, and these blood films help to really show the kind of type of anemia. You can see that there are serious clearance, which is showing that the patient is hypochromic. There is a serious sickness here, which could be as a result of the lack of iron, or the nutrients, the micronutrients, vitamins, B12 and folic acid. So the diagnosis is easy to see from the film reading. We proceed further after checking the blood films to look at other things that could happen with doing the MCV and the MCHC. This area concerns the sickle cell disease. You can see the something that looks like a Mexican hat. This is what they call the target cells. We usually use it to confirm whether there is a trait of sickle cell. There are other sickle cell shapes, although they are not present in this blood film, which we look out for. But this kind of situation, you can expect that the treatment will mean blood is usually transfused for people who have lost so much blood, like in a motor accident situation or during child delivery processes needing blood. The situation speaks for itself. This is the other diseases that one could expect from this study. The next exposition that I'm going to embark upon is on the HIV. So, and I hope you do the needful by subscribing. Press the subscribe label. Yeah, press the label, the subscribe label, and also click on the like. If you subscribe, that will be made in exposing more. The laboratory will be gigantic, and I'm sure we all want to really live healthily. We don't want anemia, and since we do not want an anemia, we need to parley with the laboratory.